scholars, and welcome back to another Powerhouse conversation on the Powerhouse Scholars channel. If this is your first time tuning in, welcome. It is such a pleasure to have you here. My name is Dr. Robusal, and on this channel, I show current and aspiring healthcare professionals how to one, quickly and successfully earn their degrees, and two, how to start, build, and enjoy profitable careers within the business side of the healthcare industry. So make sure to subscribe to the channel, turn on your post notifications, and like this video. Share with a friend who you know may find it interesting and of value. I promise, as you both join our community, you will leave better than what you came as it relates to knowing all about the business of healthcare. Now, today marks day 13 of a series that I'm calling Careermas. And over the last 12 days, if this is your first video that you're watching from the series, I have been talking about extensively different types of professions that fall under the healthcare umbrella. And so, like in our normal style, today is no different. And today's role, we're going to talk about what it takes to be a public health administrator. And this is a role very instrumental to professionals in the healthcare space who are interested in public health. However, before I jump into today's conversation, though, here's a few words from our sponsor. We are back, and as I stated today, we're going to explore what it takes to be a public health administrator. And the first thing that you must know is that public health administrators, they are really dedicated in improving the health and well-being of communities globally. And they do this by developing a variety of public health policies and programs. And in addition to developing policies, they work significantly with various types of healthcare entities. They can be everything from for profit organizations, non for profit organizations, international organizations, or even governmental organizations to really not only create programs, but to oversee how these programs are being disseminated into the communities of choice. They do everything from healthcare disparity monitoring, looking at disease progression and disease trends, just to name a few. And as a public health administrator, it's important to note that your role is very instrumental in helping communities. And when we say help communities, it's not just to provide them access to care. It's a little more than that. It's about addressing health disparities, looking at diseases, and how do we prevent it from progressing in a given community or even stop it from even developing in a given community. And that falls all under a public health administrator's role. You are administratively managing all things public health. So keep that in mind. And so some of the core focus areas of your role include things like emergency preparedness, policy development, as I stated, budget management, right? Managing the funds for the initiatives that you're launching or managing, community outreach, of course, being involved in the community. As public health professionals, a lot of your work does entail being involved in community health. Okay, so keep that in mind. And then, like any role in the healthcare space, data analysis and reporting is very instrumental to your job. And so, when we continue to explore the job description of a public health administrator, some other key things that come with your role is that you're maybe responsible for quality improvement initiatives. You may have to advocate for programs and collaborate, like I stated earlier, with all types of organizations and individuals to ensure that the programs that you have created or monitoring are being implemented effectively. And so, what are the educational requirements for a person who wants to be a public health administrator? At minimum, for this role, you do need to have a master's degree in public health. Sometimes it may be some ways around it. From all the positions that I've seen, at minimum, they've been asking for a master's degree in public health, and even a doctoral degree is preferred. So, this is one of the first jobs in this series that I talked about. You preferably having a doctoral degree. And so having either a professional doctorate, which is the doctor of public health, or a PhD, which is the research doctorate in public health, that can be very instrumental to your role as an administrator, because this is very much a leadership position. And so, if you don't have a master's or a doctorate in public health, but you're interested in the field, maybe you have done your bachelor's degree in public health, or you have a non public health degree, but you really want to transition into this industry, certifications can always help you with that. And so, a few certs that I've seen for this role particularly includes certified in public health. So the CPH certification is very instrumental, and this certification is offered by the National Board of Public Health Examiners. Or you have the certified health education specialist. If you are a person who is interested in doing health education and promotion under this role as a public health administrator, this cert may be instrumental to you, as well as the certified administrator in public health. And another cert, which this one is a industry search, but for management professionals in the healthcare space, is becoming a fellow of the American College of Healthcare Executives, which is a distinction that you can have. It is a credential that is highly recognized in the managerial and leadership side of the healthcare industry, and it can really take you far in your role as a public health administrator. So now some alternative job titles for a public health administrator include being public health service manager, health services administrator, health program manager, health policy analyst, healthcare administrator, director of public health programs, health department and administrator. And these titles are often just created based on the organization and the job description and how they write it. So just look at the job description. If you're interested in this role, if you meet at minimum the qualifications needed or the requirements that they're asking, then I highly encourage you to apply. All right, so let's talk about the salary for a public health administrator. So on average across the US, they can make anywhere from about $80,000 to $100,000 per year. If you're just getting started, $50,000 to $70,000 per year. If you have some experience, you're in the median income tier, it could be about $70,000 to $90,000 per year. If you're in the upper income tier, it can be well over six figures. And now the types of organizations that hire public health administrators include hospitals and healthcare systems, health insurance companies, environmental health consulting firms, international healthcare organizations. They're always looking for public health administrators, foundations and philanthropic organizations as well, healthcare consulting firms, as well as health advocacy organizations. They are all interested in hiring public health administrators. And so with that, the $1 million question is becoming a public health administrator right for you? And I will tell you, this role is very right for you if you are an individual who will enjoy leading public health organizations and preventing disease transmission and development across communities or even across nations. All right, so that is all that I have for today's conversation. I hope you found it very instrumental. Make sure to like, subscribe, and share to this video, and have a great rest of your day. I look forward to connecting with you tomorrow for Careermas Day 14. Bye for now.